We hear news of breakthrough to cure cancer on a daily basis, but none has been proven to be safe and effective enough to cause for jubilation. Instead of waiting for new breakthroughs to cure cancer, you can do a lot to protect yourself right now. We know that early diagnosis is important, but there is something better. You can reduce your risk of getting cancer in the first place. Scientists at the Harvard School of Public Health estimate that up to 75% of American cancer deaths can be prevented. It sounds too good to be true, right? For most cancer types, prevention is the most important thing to do. Don't wait for a cancer diagnosis. Start making changes today to reduce your risk and have a healthier life. By following these 15 anti-cancer tips for cancer-free living, you can significantly reduce your risk of getting cancer even if it runs in family. Number 1. Stop smoking. If you are a smoker, it is highly recommended that you stop smoking. Smoking is the primary cause of lung cancer and also leads to various other types of cancers, including throat, mouth, cervical, and bladder cancer. By quitting smoking, your body starts to recover immediately, and after 5 years of quitting, your risk for many cancers is significantly reduced. Consult your physician for advice on ways to quit smoking. 2. Avoid staying close to cigarette smoke. Did you know that inhaling cigarette smoke without smoking can cause lung cancer in adults who have never smoked? Try to avoid secondhand smoke, and if you live with someone who smokes, encourage them to stop. 3. Eat properly. Eat more plants. Avoid refined or processed foods. Reduce your consumption of saturated fat and red meat, which may increase the risk of colon cancer and a more aggressive form of prostate cancer. The American Cancer Society recommends eating a healthy diet, with an emphasis on plant foods. Eat at least 2½ cups of vegetables and fruits each day, and minimize your intake of processed meats such as hot dogs and lunch meats. If you do eat meat, choose fish, poultry, or lean cuts of beef. 4. Exercise regularly and be more active. Engage in regular exercise and increase your physical activity levels to lower your risk of developing cancer. Studies have shown that physical activity can reduce the risk of breast cancer, endometrial cancer, prostate cancer, and colon cancer. Exercise can provide protection against cancer, even if you don't lose weight. The American Cancer Society recommends adults to engage in at least 150 minutes of moderate intensity activity each week, and children and teens should have at least 1 hour of moderate intensity activity each week. Examples of moderate activity include walking, golfing, yoga, and gardening. Please subscribe to our channel so that you will be notified when we release a new video on how to stay healthy. 5. Stay lean and watch your weight. Maintain a healthy weight to reduce your risk of developing several types of cancer, including breast and colon cancer. Excess weight around the midsection increases your risk for other diseases such as diabetes and heart disease. To check if you're at a healthy weight, you can determine your body mass index on our website. We will add the link to it in the description below. Number 6. If you choose to drink alcohol, limit your intake to no more than 1 drink per day. Consuming excess alcohol increases the risk of cancers of the mouth, larynx, esophagus, liver, and colon. In women, it also increases the risk of breast cancer. Smoking further increases the risk of cancer caused by alcohol consumption. 7. Reduce unnecessary exposure to radiation. Only undergo medical imaging studies when necessary. Check your home for residential radiation, which increases the risk of lung cancer. 8. Avoid exposure to industrial and environmental toxins such as asbestos fibers, benzene, aromatic amines, and polychlorinated biphenyls. Mesothelioma cancer, which affects the outer lining of the lung or chest cavity, is largely caused by work-related exposure to asbestos. 9. To reduce your risk of cancer, it's important to avoid infections that contribute to it, such as hepatitis viruses, HIV, and the human papillomavirus. Many of these infections are transmitted through sexual contact or contaminated needles. We have a video on hepatitis B. We will add a link to it in the description below. 10. Limit your exposure to environmental pollution. Outdoor air pollution is estimated to have caused 4.2 million premature deaths worldwide in 2016, with 6% of those deaths being attributed to lung cancer. Additionally, close to 4 million people die prematurely due to household air pollution caused by cooking with solid fuels and kerosene. Please subscribe to our channel so that you will be notified when we release a new video on how to stay healthy. Number 11. Avoiding occupational carcinogens is crucial for lowering your cancer risk. Lung cancer associated with occupational exposure to crystalline silica, welding fume, and diesel engine exhaust. Bladder cancer are well documented to be caused by exposure to occupational carcinogens. 12. Stand up more and avoid sedentary lifestyle. Studies have found that individuals who spend most of their day sitting are more likely to develop colon and endometrial cancer. To lower your risk, try to stand up and move at least once an hour. Stand while you're on the phone or take a walk around the house. A few minutes of light activity throughout the day can add up and help lower your cancer risks. 13. Protect your skin. Protect yourself from excessive exposure to ultraviolet radiation from the sun, which can lead to melanomas and other skin cancers. Always apply sunscreen with a minimum sun protection factor of 15 when you're in the sun. Some doctors recommend using at least sun protection factor of 30. Wear sun protective clothing, hats that cover your skin, and sunglasses to protect the delicate skin around your eyes. 14. Get vaccinated. Vaccines are available to protect your body from viruses that can cause cancer, such as human papillomavirus and hepatitis viruses. Getting vaccinated is an effective way to lower your cancer risk. We have a video on how to prevent hepatitis B infection. We will add a link to it in the description below. 15. Get screened. Routine medical care is essential in lowering your cancer risk. Make sure to get a checkup done every year and talk to your primary care physician about which screening tests you need. If you don't have a primary care physician, you can contact us via the link in the description below for guidance. Please note that knowledge is advancing by the day, and we will like to always post an update on cancer prevention and new advances on cancer treatment. Thanks for watching. Please subscribe to our channel to know when we post a new video on how to stay healthy. You are watching Zoom Hospital channel.